What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering things I didn't expect to go through in X-ray tech school. So to give you context, I am a night shift X-ray tech. Been doing it for over 4 years. And to this day, I have nightmares of certain aspects or just like dreams of certain aspects of X-ray school that to this day haunt me, and I think it'll be forever. There was a time where in certain classes, the quizzes would be spontaneous over the stuff we would learn. And I wasn't the smartest person, so I would always struggle to regurgitate the stuff we literally got told. That would forever terrorize me. I do terrible on some of those quizzes. Or the other one thing that to this day, it'd mainly be because other students would ask questions or get on side grants and topics. It would cause the teacher to get behind on the PowerPoints or whatever she was learning. And I swear to you, we would be going through the PowerPoint and she's like, we're gonna cover all this PowerPoint this class. And you're like, cool, fine. You look at it, it'd be like 50, 60 slides. There would be very few minutes left in the class, and we're like on number 30 slide. And the amount of the teacher, because she would have a clicker, she'd be like, just like clicking, and just the last several minutes just click, 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 just to go through the whole thing. And she's like, see, told you, we covered the whole fucking 60 PowerPoint slide. And I'm like, yeah, but I ain't learned nothing. Like, I was struggling to write notes and stuff like that. And I was like, it was a cluster. She would be notorious to do that. And we would always blame little Timmy in the back because he would ask questions or get side quests on other stuff. That to me terrorized me to this day. Or the aspect of, in certain classes, you would learn something, and if you didn't master it or you didn't get the concept, you would not backtrack to learn that again. That was something for me that was always astonishing, that just blew my mind, because some of the things I was like, I try to learn it, I can't. I'm like, you know what? This is gonna be that one thing on the test. I'm gonna just fail this one. It's too much shit to learn. I just need a 75, fuck it, just like, let me focus on the other stuff that I can actually learn. So there were some things, I think it was like in the physics class, that to this day haunt me. Or there was one time where I had to miss one of my classes so I could have focused more harder on the exam for another class. That's something to this day that astonished me forever, that it was like a really, really hard class. And one of the tests, and I remember having to do that. That was just bizarre. Even our teachers, like, there was a lot of people missing so-and-so's class today. And you were like, yeah. Or enemas, that's a new one. I was not expecting that at all. Most people think, of the beloved just X-ray bones and films. And enema was probably the reason I mainly said F fluoro, and I don't want to do none of that. I could do it, but I'd just rather not. So if you work night shift, depending on what trauma or where you work at, you don't have to do it. It's not 0%. It's like Germix. It's like tiny low percent that you have to do it. So because it's never good. There was never a single enema patient that came in that was just a walkie-talkie. It was always people who were either just super constipated, old people, and it was never a good experience. To this day, it terrorizes me. I don't like it. Other people, they enjoy it. They love it. That's their whatever. And I'm like, good for you, bro. It couldn't be me. Or when I learned my first clinical site, my first chest x-ray I had to do, and I learned how quickly And I remember sitting with the tech to this day. He taught me a lot of things. I was like, yo, bro, show me from like the beginning to the end with this one patient how to get it done. And Humbo went up there, talked to the patient real quick, beep, and then ended the exam, put it online. And he's like, that's it. And I'm like, bro, so you tell me it takes less than like 30 seconds to do the X-ray and then another maybe 1 minute to put everything online, and that's it. And I was like, bro, this is easy money. I got this all day. And that's kind of like where I fell in love with just doing basic film. So to this day, chest X-ray all day, bread and butter. Love it. We'll never get sick of it because there's other stuff, other exams, and it's just harder. And I'm like, why? Why two view when the one view is good enough? So let's see what else we got. I think the biggest one is the amount of information that gets like thrown at you and just like pushed down your throat just to come out here and forget 90% of that knowledge just for all day. Just hold your breath. Beep. Let me just erase. Take another beep. Just beep. All right, let me just bump up the technique a little bit. Beep. You don't use none of that other knowledge. Even if you're like, oh, Miguel, surely you use the KV 15%. No, and most of the time, we're not doing math in your head. And you got a patient over here yelling at you and you're in the mid-code trauma. You just look at the exposure number and then you're just like, beep. And then you look at it and like, is it burnt or is it under, over? And then you just readjust. Most of the time, we ain't doing math. Especially like night 7 with your brain all foggy. You're not doing math, bro. Like, some of the things. I know back in the day, I've been told by some of the like veteran techs with the film and the other stuff, that one, you would have to be on top of your stuff technique-wise, or else that shit, when you would throw up the film on the board, it'd be crispy and burnt, and then you look bad. All right, so you had to be on top of your stuff, or your collimation, your positioning got to be exact. And it was apparently a whole different Xray over there that terrorized the older generation. So we have it very good and easy. Even when I was beginning school, I always thought we would have to do film because I started during 2019, I think. I always imagined film because always in the movies and the TV. Before that, I never got an X-ray done before, so I really didn't know. And in my family in Mexico where I saw X-ray done, they would still do film. So like I remember the first day of school, the teacher like threw a little film up and it's like, this is a picture of a chest. And I was like, I was like super excited. And then she's like, we don't use these no more. And I think to this day, I still have somewhere in my backpack a little film strip they gave us. I have that as just like a little charm, just to have a piece of film. If I find it, I'll show y'all. But you can ask your teacher. I'm pretty sure a bunch of the school has film that they use as an example. So that's something that's always surprised me. Or another thing is when you're out there in the field, the lack of Alara that they don't give a fuck about. You'll learn that quickly. That Alara, what is it? Only you and your team of radiology know what that is because these doctors, these residents don't know nothing about that. They could care less about that. It's always up to us. Even pregnant ladies, even kids, even everything. You will see it all and you'll question things, but at the end of the day, they just want you to press the button and get the picture done. So that's something that surprised me because like you would think, oh, radiation, cancer, maybe we should be more careful with it. Not you would feel like everyone who comes in just X-ray, X-ray, X-ray. And it gets to the point where even the patient sometimes like, why? And you're just like the doctor. And they're like, but why? And I'm like, you can talk to your doctor if you don't want it. I'm just here because they ordered it. So that's something that surprised me. I always thought it would be more like less use, but CAT scan's even worse. They order a bunch of CAT scan, and their dosage is way higher than ours. That was something that also amazed me as a student. But oh, and then learning how quickly the pedestal of between the nurse and Xray, and where you fall in the ranking of how they treat you. Just know that Xray is at the very bottom, and the hospital cares more of the nurses. Just put that out there. You can see that in every single aspect of pay, of less shitty equipment. Oh, and then shitty equipment, that one too. Every single site I went to as a student, it's like pick your shitty equipment and deal with it. And even as a student, I remember going to different sites, different places, and it's like trying to learn their shitty equipment because you thought it worked like this, but you're in a new place and they have a different shitty equipment, and then it's just a whole little chain fuckery. Even to this day, we try to explain to students that they're all fucked up, and they've been telling us for many years. There's like a tech here been 25 years or 20 years, and he said, yeah, they've been promising me new equipment since I started, Miguel, so good luck. So just know that's something too, because like the way they always speak of it in the commercials and stuff like that, state of the art technology, only the best equipment, and then you're just now looking at it, you just kind of laugh, because at the end of the day, the best situation is you hope when you click the button it shoots, because that's like very frustrating, because sometimes it don't shoot and it makes you look bad during the trauma room. And I remember as a student seeing that, and I think the biggest frustration was being in a trauma room and seeing a tech struggle so bad, and then they look at me and they're like, go get the other portable, and they run over there, go get the other portable, bring it up, beep 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 beep, and then not knowing how to help them, because you don't know what's wrong with their equipment, because it's, once again, it's shitty equipment, and you don't know because you're a student. The best thing you could do is just bring another one, and feeling like you can't help. That was something that was always, and it was pretty humiliating, even though it wasn't even your fault. So, but that's all I got for you. Hope you enjoyed today's video. We'll see you on the next one.